Good evening, ladies and gentlemen. Welcome to all of you once again in our second lecture of the lecture series entitled Life After Cardiac Event. We had a lot of suggestions about variety of topics that we needed to cover, but we upheld this particular suggestion because I thought this topic is not very well dealt at one particular place, and a lot of you wanted to know about the role of micronutrients and vitamins in cardiovascular health. I think micronutrients, as you all know, are vitamins and variety of minerals. We know that vitamins can be categorized into those which are fat soluble and those which are water soluble. The fat soluble vitamins are vitamin A, D, E, and K, and the water soluble vitamins are vitamin B and vitamin C. Besides these, there are multiple other minerals like calcium, magnesium, manganese, phosphorus, iodine, zinc, copper, sulfur, chromium, selenium, etc., which may be very, very important to us in very, very minuscule, very, very minor quantities. Mind you, unlike the important constituents of our diet, which are carbohydrates, diet, and proteins, vitamins do not provide energy or the calories. But their role is very crucial as coenzymes or as modulators of variety of chemical processes in the body which generate very important byproducts and importantly some of the sources of energy. This chart shows you what are the sources of variety of these vitamins. And if you would want to have a quick look, you can, or you would want to take a quick snapshot of this particular screen, it is most welcome. You can see that there are variety of fish, meats, eggs, variety of dairy products like cheese, cream, etc., besides a lot of vegetables like broccoli, variety of full grains, important nuts, leafy vegetables like spinach, and mashed potatoes, sweet potatoes, yogurt, olive oil, sunflower oil, etc., which give you all these vitamins. On the right side, there are certain deficiency diseases which are listed. Just want to make a note of one thing, that the water soluble vitamins like vitamin B and C, even if they are consumed in excess, they do not cause hypervitaminosis. Whereas other vitamins like A, D, E, and K, since they are fat soluble, they require fat for absorption and they are stored in the fat and can cause hypervitaminosis if they are consumed in excess. Besides these particular vitamins, there are certain common minerals which are required in daily allowances, but these requirements are very, very small. Some of the important sources of calcium, iron, zinc, magnesium, potassium, including things like chromium, have been mentioned here. The role of vitamins and minerals are multifold. Role is included in increasing the contractility of a small cell of the heart muscle, which is called as the myocyte, and it becomes a very, very important thing in people who have a failing heart or people who have had reduced ejection fraction. These vitamins and minerals, by playing variety of roles, prevent hardening of the arteries, help to maintain the vascular tone, and also avoid deposition of calcium, which ultimately lead to significant hardening of the deposited fat, which is the atheromatous plaques. Most of these play a very vital role as antioxidants, and subsequently in the lecture we will see what exactly is an antioxidant and what is its role. Vitamins also play a very important role in vascular smoothing. It plays a very important role in some of the side effects and complications seen in diabetics. It has a major role in thrombosis and blood pressure maintenance. Let us look at some of these vitamins individually. Vitamin A is involved in many bodily processes, including vision and skin health, but somehow it does not play a very, very major role in the cardiovascular health. Vitamin D, there was almost an epidemic more than a decade back when people talked a lot of things about vitamin D, about its role in cardiovascular health, about how the deficiency will lead to atherosclerosis, how the deficiency will lead to a variety of cardiac problems. And all of us know that almost every physician started ordering levels of vitamin D. These are some of the articles which I have brought in front of you in a pictorial form, which give you a lot of vitamin D. What is important is that if you have a very good exposure to the sunlight, you do not really require to take additional supplements of vitamin D. Now, the best role of vitamin D is in developing strong bones. And the low blood levels have been linked to an increased risk of heart attacks and strokes also, as I said before. Vitamin D has received a very, very widespread attention in the last couple of decades and also in the pathogenesis of type 2 diabetes. In fact, several epidemiological studies have suggested that individuals with low blood levels of vitamin D have an increased risk of heart disease. The initial prospective studies have also demonstrated that vitamin D deficiency increases the risk of developing hypertension or even sudden cardiac deaths. Recently, few studies have found that vitamin D supplements did not have a significant role in the cardiovascular health and did not boost a cardiac health, which means you can clearly see that even in the medical literature, there is a yo-yo between benefits of cardiovascular health versus no benefits of cardiovascular health. Sometimes we begin to ask a question, is it a cause of these cardiovascular problems or is it the effect? I personally feel that yes, it probably has some role to play. However, what is important to know also is that a lot of people who are deficient in vitamin D are sedentary, do not work out aggressively, do not go in the sunlight, exercising in the morning or having a brisk walk in the early morning, and it is probably an indicator of poor lifestyle. Coming to vitamin E, these are some of the important ingredients of food which contain vitamin E, and you can see that probably we pretty regularly consume these in our diet, barring a few which are pertinent more to the Mediterranean diet. But nonetheless, a lot of these things are now available in India as well. Vitamin E supplementation has an important role in delaying the onset of diabetic complications as well as for slowing down the progression of complications like retinopathy and foot ulcers and cardiovascular complications. There were no significant treatment effects of vitamin E in the rate of stroke, cardiovascular death, total mortality, and of all other secondary and additional cardiovascular outcomes in non-diabetics. And therefore, it is of importance to note that there is a pendulum once again about the medical opinion going from one end to the other, which has swung now to suggest that high dose vitamin E supplements have no place in the treatment and prevention of cardiovascular disease. The new data is emerging that in fact allows identification of a specific target population for this treatment with vitamin E. Now, what are these subsets of population which can benefit with vitamin E supplement? These are predominantly diabetics who exhibit a lot of vasculopathy. What is a vasculopathy? Vasculopathy is nothing but a disease and a disorder of the artery. And we know that diabetes is one of the most important major risk factor which contributes to all the vascular events like strokes, heart attack, and peripheral vascular disease, leading to gangrene and diabetic foot. So, if you have a diabetic who has vasculopathy, probably that gentleman is likely to benefit more with vitamin E supplements. In Indian subcontinent, there is a genotype called as haptoglobin genotype 22. In this particular genotype, it is estimated that the risk of coronary artery disease is very, very high, and even individuals who are pretty young suffer from heart attacks. Coming to vitamin K. Vitamin K is a fat soluble vitamin, as I said before, and plays a very vital role in blood coagulation. It has a potential role in high risk cardiovascular disease and chronic kidney disease. And mind you, if you have a liver disease which is more chronic, you are likely to suffer from deficiency of vitamin K because liver is the storehouse of vitamin K. Coming to most important, all of us probably know and we have heard enough about vitamin B complex. There are various types of vitamin B complexes, right from B1, B2, B3 to B6, B9, and B12. And the simplest and the most abundant source of these vitamins is nothing but the whole grain. You can see in this diagram that there are a variety of legumes, dals, rajmas of various types, and whole grains which are seen on the right side of the screen, which give you a lot of vitamin B12. There is a very close association between homocysteine and B complex. I'm sure you have heard about serum homocysteine levels, and once again, there was almost an epidemic of homocysteine deficiency, homocysteine excess when this particular entity was established approximately 25 years back as one of the important causative agents for early atherosclerosis and early atherothrombosis. Thrombosis means formation of a clot within the artery or vein. What is homocysteine? Homocysteine is an amino acid in the blood, and elevated levels have been linked to a variety of problems like dementia, including heart disease and stroke. But the best news, homocysteine can be lowered very easily and very inexpensively with supplements of triad of vitamin B, which are B6, B12, and folic acid. Elevated total homocysteine levels have been identified as a risk factor for cardiovascular disease. But at the same time, surprisingly, once again, there are contradictory reports that homocysteine lowering interventions in the form of supplements of vitamins given alone or in combination at any dosage compared with placebo prevented heart attack or reduced death rates in participants at risk or living with cardiovascular disease. This was not found to be true. Coming to vitamin C once again, I have said this earlier also. There are these important ingredients of our food which are very easily available, not very expensive, like fruits and especially the citrus fruits which are seen in this particular picture, and a kiwi fruit which are very rich sources of vitamin C. We all know that other vegetables like seen here are also important sources of vitamin C. Very important antioxidant. If you already have heart disease, vitamin E along with vitamin C play a very, very major role in prevention of heart attack. It helps, vitamin C helps vitamin E work better in our bodies. It also improves the way your arteries work. What does this mean? In fact, you all will know that arteries are under continuous stress and strain, and therefore sometimes they constrict, sometimes they dilate. And this particular phenomenon of an arterial constriction and dilatation is called as vasomotion. A good vasomotor tone is very, very important for cardiovascular health. These vitamins together help to maintain a good vasomotor tone, and these together also help to protect your arteries from oxidized cholesterol. What is this oxidized cholesterol? We are going to see that in a while. Something very, very interesting, and I was also a little surprised to find out the use of more vitamin C per day was associated with increased cardiovascular risk. In short, what is important is that we have to have a moderation of these supplements. In fact, when I say that we have to have a moderation of these supplements, I am trying to make a point. Do we really need to take all these supplements on a very regular basis? And if yes, we have to probably identify the individuals who will benefit from such supplements. And I am going to come to that in a short while. What are the other important elements here? Calcium, phosphorus, found in great quantity in milk and milk products. Calcium keeps your muscles, nerves, and blood vessels working well. And in fact, it's one of the key minerals involved in the blood pressure control. Yes, that is true. It helps build and maintain healthy bones and teeth, and also is very, very important in maintaining a good contraction of the heart muscle. Phosphorus plays an important role in how the body uses carbohydrates and fat. Mind you, excess phosphorus promotes pathological calcifications of vascular media and heart valves. I have been asked this question by several patients who undergo rotational atherectomy, which is the drilling of calcium before we implant the stent, as to why does the calcification of the arteries occur. Normally the calcium is present in bones, but when there is excess phosphorus superadded with significant degree of blockages in the arteries, what is called as the atheromatous burden, it leads to deposits of calcium in these arteries. Another important mineral is the iron. We all know that iron is very, very crucial in formation of hemoglobin, which is nothing but the carrier of oxygen. And one cannot stress more the importance of iron here, because all of you know about this. Sodium. The natural sources of sodium, the best source is the table salt. There are other products which are also rich in sodium, and these are some types of meats, dairy products, especially cheese, and canned foods. It has various functions in the body, but one of the most important functions is that it influences the contraction and relaxation of the muscles of the heart. It also plays a very crucial role in the vasomotor tone or vasomotion that I described earlier, and therefore has a very important role in the blood pressure regulation. We all know that excess sodium can lead to hypertension. Next important micronutrient is a coenzyme Q10. Now, you probably may not have of coenzyme Q10, but it is rich in salmon, tuna, and some of the meats like liver. Whole grains are also a very, very good source of coenzyme Q10. It is one of the most important lipid antioxidant. I have been talking about oxidation, lipid peroxidation, antioxidants, etc. We will in a while see what exactly these mean. Now, this prevents the generation of free radicals, and if free radicals are generated, because free radical generation or the toxic oxygen radicals radical generation is absolutely mandatory in any metabolic processes. But we have a scavenging system in our body which cleans up all these free radicals and therefore prevents aging or cell death. Coenzyme Q10 is one such important scavenging mechanism of our body. It also improves symptoms of congestive heart failure, and it might help to reduce blood pressure. And if combined with other nutrients, It might aid recovery in major surgeries like bypass surgery and heart valve replacements. L-carnitine, once again a micronutrient. It is a special amino acid which plays a key role in transporting fatty acids. We have commercially available L-carnitine, and which is a major source of energy to the heart muscle. In athletes, it is also known to improve the stamina and endurance. For people who have cardiac ailment, 1 to 2 grams of L-carnitine has been recommended as initial therapy. Taurine, another micronutrient, is a special amino acid found in muscle, brain, and heart muscle. It helps the heart muscles to contract, it lowers the blood pressure, and is a useful treatment in congestive heart failure. Once again, it has an antioxidant effect and is found in fish. The supplementation of taurine has been advised in diabetics and especially diabetics who exhibit diabetic nephropathy or derangement of their kidney function. Chromium, which is a micronutrient. Organists agree that chromium is a trace metal that is vital to human health. It has an important role in normal metabolic functions, particularly of the carbohydrate metabolism. Of importance to cardiovascular health is the finding that chromium supplements boosted HDL cholesterol. What is the HDL cholesterol? We all know that there are two components of blood lipids, good cholesterol, the bad cholesterol. HDL is classified as good cholesterol. So higher the level of HDL cholesterol, better it is. In one of these studies, the supplementation with chromium was found to have a beneficial effect on the total HDL levels, which increased by 16%. And what was its translation in terms of coronary artery disease? The increase in HDL cholesterol level reduced the risk of heart attack by about 20%. What are the important food articles which will give you chromium? Peanuts, legumes, and whole grain. In short, by this time you have realized that we do not have to make a very, very special effort. We do not have to make special trips to food supplement stores or vitamin stores. In fact, in Western countries, you will find that there are mega stores which cater and which sell a lot of vitamin and micronutrient supplements. Coming to another micronutrient, the copper. We get enough copper from cereals, barley, legumes, nuts, shellfish, and meats. Studies reported an association between high copper levels and heart attacks, and therefore it has to be not essentially supplemented. Whatever best you can get from normal food is good enough store or intake of copper. Selenium is an antioxidant and it may help in preventing free radicals from damaging cells. Once again, coming to the cell theory. Tomatoes, poultry, shellfish, garlic, egg yolk are the main sources of selenium. Very interesting. A data of 11,000 men and women found that people with low levels of selenium in blood had an increased risk of developing coronary artery disease. Until more data is available, selenium cannot be recommended as a supplement. So whatever you will get by way of eating poultry, tomatoes, meat, and egg yolk is good enough. Magnesium is essential and valuable mineral that is necessary for everything that a cell does in the human body. It has a beneficial effect in ischemic heart disease, cardiac arrhythmias, and as I said, it has a very, very weak antioxidant property. We have heard a lot about these herbs like ginkgo biloba, grapeseed extracts, and garlic, mind you. Biloba plays a major role as an anticoagulation, so prevents blood from becoming very, very sticky. Grape seed extract and garlic play a very major role as antioxidants, besides having some property on the blood lipid lowering as well. So finally, we are talking about antioxidants. We talked about every mineral, we talked about every vitamin having some role or major role as an antioxidant. As per AHA, the results of a large-scale study suggests no beneficial effect of long-term supplementation of antioxidant vitamins and minerals on carotid atherosclerosis and arterial stiffness in healthy individuals. Very important to note. Studies show there is no evidence of a diminishing effect of antioxidant or B vitamin supplements on the progression of atherosclerosis. And therefore, you'll be not surprised that it did not support the role of vitamin B in post-angioplasty patients. A number of dietary factors are proposed to act as antioxidants and have been suggested to protect against coronary artery disease. The overwhelming evidence suggests that people who eat a diet rich in antioxidants like vitamin C, vitamin E, folate, beta carotenes, ubiquinone, which is the coenzyme Q10, bioflavonoids, selenium, manganese, zinc, and copper have a lower incidence of heart disease. These high circulating levels of antioxidants may reduce the effects of oxidation and prevent the damage caused by oxidized LDL cholesterol. What is important here is that whenever we talk about antioxidants, we harp about beneficial effects of variety of antioxidants, vitamins, minerals, and their role as antioxidants in preventing oxidation of lipids. It is also important to note that most of these antioxidants can be obtained through your normal diet and you do not need to supplement additionally. However, there are certain categories of patients who probably will benefit from these, and these patients are people who are clearly vasculopaths, people who have had multiple episodes of heart attacks, strokes, peripheral arterial disease, gangrenes, or diabetics who are very prone to such problems, people who have had a significant history of having had vasculopathic events, people who have variety of malabsorption syndromes. Malabsorption syndromes are not very uncommon in Indian subcontinent and there are multiple reasons for these. But if you are also a food faddist, if you are an extremely pure vegan and you have variety of food faddisms, then you probably may require supplements. But the fact of the matter is that if your is very well supplemented, if you are eating good amount of antioxidant proteins, which I have just highlighted in this particular slide, then you
Atherosclerosis
do not
refers to a
need
condition in which
to
plaque
have
gradually builds up in the wall of an artery.
supplements. This particular video shows you what is oxidation of lipids. You can see that this is the heart, these are the arteries on the
When
surface of
fatty
the heart.
deposits containing
This is the blood
cholesterol enter the
flowing.
blood vessel
You can
walls,
see the
immune
inside of
cells
the
are sent to the
artery very
site to
clearly.
collect these fatty
These are
deposits
the
and
lipid
transform them
particles
into hard plaque.
which are getting deposited, which are getting internalized into the arterial wall. There are certain cells like these. They
This
are
causes the walls to
fibroblasts.
thicken,
These
meaning less blood can
fibroblasts
flow through them
accumulate
at a
a lot
time.
of lipids, grow in
Atherosclerotic
size, and
plaques
these
are
are called
visible as
foam
bulges
cells.
along the affected
And these foam
artery and
cells,
can
when they
rupture
keep
and
on
form blood clots
accumulating
within the
just beneath
arteries.
the superficial layer, they form an obstruction in the artery, leading to an obstruction, diminished blood flow, and heart attack. So unless and until the lipid or the fat, the bad fat in your blood is oxidized, it will not get deposited in the arterial wall. So what is important is that we prevent the oxidation of our lipid by taking a very balanced food, which is shown here. It contains some poultry, some milk products, some meat, variety of fish, a lot of green leafy vegetables, tomatoes, onions, carrots, beetroots, broccoli, variety of fruits which include a lot of citrus fruits. I think if you make sure that your food is very, very well balanced, probably you will not need to supplement your diet with vitamins and minerals to keep your cardiovascular health good. With this, I just want to thank all of you for joining me on this auspicious day of Ganesh Chaturthi. I think I would like to make an appeal to all of you that whenever we start anything new, anything good, we always take the name and worship and pray Lord Ganesh. I think today is a good day to embark upon a very, very healthy and balanced diet to make sure that you do not really require a lot of supplements. Today is also Samvatsari, which for Jainis they know that it's an important day, Kshama Yachana day, but also they do what is called as Pratikaman, which is nothing but introspection of the problems in your life. So I think it is also a good day to introspect whether you have been having a healthy diet or not. And if not, please embark upon a very healthy diet right from today. So with this, I'm sure some of your concepts about micronutrients, minerals, and variety of vitamins may have become clearer today. Sincere thanks to all of you, and to stay updated with my latest videos and cardiology related important tips, like and follow Hardas Heart Care official Facebook and Instagram page. If you are watching this video on YouTube, make sure to subscribe to this channel and click on the notification bell. That way, whenever I come back with a new video, you will be. Thanks a lot for your love and support. Wish you all the best. Have a very healthy and a good weekend. Very soon, we will come back to you with a new lecture, which will be on the investigations done in a case of cardiovascular problem. Good day. Thank you.